Carbonic anhydrase inhibitors. Before we start talking about carbonic anhydrase inhibitors, let's talk about what carbonic anhydrase is. So carbonic anhydrase is an enzyme that is found in the kidneys, eyes, and other parts of the body. So it makes hydrogen ions available for sodium and water exchange. So it allows sodium and water to be reabsorbed back into the blood. So this cannot occur without hydrogen ions available for exchange. So if unavailable for exchange, the sodium and water will be eliminated in the urine. Now that we have somewhat of an understanding what a carbonic anhydrase is, let's talk about the mechanism of action of carbonic anhydrase inhibitors. So this is where the carbonic anhydrase inhibitors work. How does it work? So inhibits the carbonic anhydrase activity at multiple sites, but work at the location of the carbonic anhydrase enzyme system along the nephron, primarily in the proximal tubule. It decreases hydrogen availability for sodium and hydrogen exchange in the proximal tubules, resulting in water and sodium excretion. In addition, it also decreases aqueous humor production. So aqueous humor is a clear fluid filling the space in the front of the eyeball between the lens and the cornea. Therapeutic effects include decrease in circulating sodium bicarb, therefore altering the acid-base balance. It also decreases the aqueous humor production, which results in a decreased intraocular pressure, and it also causes renal sodium water excretion, primarily in the proximal tubules. Indications include altitude sickness, glaucoma, and edema that's resistant to other treatments. So altitude sickness, the mechanism of action for this specific purpose is actually unclear. In addition, it helps with metabolic alkalosis. So it decreases the circulating sodium bicarb, which is released by the pancreatic duct cells in response to acid in the duodenum. So therefore, changing the pH and correcting the metabolic alkalosis. Glaucoma is an obstruction of outflow of aqueous humor. So as mentioned earlier, these medications actually decrease the aqueous humor production, therefore helping with the increased intraocular pressure. And again, it helps with edema that's resistant to other treatment, especially secondary to heart failure. So if your patient has edema caused by heart failure and is quite hard to treat, and we've tried the other medications, this may be a time to start them on carbonic anhydrase inhibitors. Precautions include electrolyte and fluid volume disturbances. Some contraindications include severe renal or hepatic dysfunction. It is also contraindicated with pre-existing electrolyte imbalance, most specifically hyponatremia and hypokalemia, so low sodium and low potassium, because this medication increases the excretion of sodium, potassium, bicarb, and water. Next, although the product labeling lists sulfa allergy as a contraindication, the scientific basis for this has been questioned, and they're often used in patients with sulfa allergy anyway. That being said, it's still important to monitor for possible allergic reactions. Side effects or adverse effects includes acidosis due to the decrease in circulating sodium bicarb and hydrogen availability, hypokalemia because of the increased excretion of sodium, potassium, bicarb, and water, and drowsiness and paresthesias. Some nursing actions include assessment of blood pressure, intake and output, BUN, creatinine, your electrolytes, which includes your potassium, magnesium, sodium, and your acid-base balance or your blood gases. An example of drug in this class is acetazolamide or Diamox.